and leading up to it, I'm reflecting on the crucial role that healthcare providers play in engaging people living with HIV with the healthcare system. And I've seen this in the work that NASTAD's global program has been doing in Jamaica over the past few months in conjunction with Jamaican health facility and health authority staff, as well as CDC. Last spring, we identified over 500 patients living with HIV who were out of care at one clinic. And together we were able to implement a return to care program and re-engaged 157 people back into HIV care. So that's nearly a 29% recovery rate. And we were able to do this because we believe that a phone call or home visit coming from a place of genuine care and concern for these individuals is often enough to overcome experiences of isolation that people living with HIV may often have. And what's more is that through this Return to Care program, in total we contacted nearly 400 of the 500 plus individuals and resolved their status. It turns out that many of them had been seeking care elsewhere, so this prompted our team to improve tracking and reporting systems across health facilities to better understand people's situations.
A team of talented and passionate public health professionals who are working with the Ministry of Health, implementing partners and facilities to implement index testing, which is also known as partner services or partner notification services. So this is a process by which sexual needle-sharing partners, biological children, and social contacts of persons living with HIV are notified of their exposure, tested, and also linked to care. Since July 2017 to date, we provided technical assistance to 89 CDC-funded health facilities. Our technical assistance includes training health providers and equipping them with the tools necessary to implement partner services, monitoring facilities' performance, and providing ongoing support when needed. So this is an approach that is drawing us closer to the end of the HIV transmission by ensuring that more people living with HIV are aware of their status and are able to get the care they need to manage their infection. So we're looking forward to integrating other innovative approaches to partner services in Haiti, such as recency testing and PrEP for HIV negative partners, to help us get closer to the end of the HIV transmission.
The biggest issue there would be counseling, where we have the professional counselors employed to do the general pre-ART counseling and pre-testing and post-testing counseling. And if you got positive, of course, we would need to put you in a clinic. So we have to link you, and as we do the linkage, we use the expert clients here that do more additional counseling, whereby the expert client, as I talk to you and link you and share with you my experience, you get motivated to start on treatment.
All right, Kudaish, thank you for joining me in this mini interview. As I mentioned before, my name is Juan and I work with NASTAD and I work in their global program. Let's jump right in. Given that the theme of World AIDS Day 2018 is Let's End It by ending isolation, stigma, and HIV transmission, what is your organization or what are you doing to combat isolation?
We have a very vibrant, innovative measure of combating isolation in our organization. It is called the Positive Health, Dignity, and Prevention Innovation, where we reach out to our peers, the ones that we work with, especially those within the ages of 10 to 24, and we mentor them, we give them empowerment, we give them information and education to make sure that, one, they stop isolating themselves upon realizing their HIV status, but also to be able to confront the rest of their peers that may be directly isolating them from within the societies where they live. In most cases, we realize that young people, especially those in school that are HIV positive, they are isolated from several school programs and from several school activities because of their several status. So all we do is to embark on our regular school outreaches and give them the information, give them the facts underneath about HIV, and also give them the empowerment that is ideal for them to stand out and be advocates of change.
Hi, I'm Dr. Rita Isabel Lechuga, and I'm a senior manager with the global team at NASTAD. I lead the work we are doing in 5 countries in Central America, which is focused on strengthening and increasing the availability of strategic information in response to the HIV epidemic. It's been a pleasure to witness how these countries are inching closer and closer to achieving the goals they have committed to, not only international goals, such as Sustainable Development Goals, but setting their own national targets and being strategic with their work and investments. They are increasingly approaching the HIV epidemic by partnering with sectors outside of health, recognizing that the epidemic is heavily driven by health inequities, including stigma and isolation. Countries, including Guatemala and El Salvador, are working towards improving the right to access sexual and reproductive health care services successfully advocated by women and girls. Honduras has removed HIV criminalization laws. Panama's government pledged to strengthen their response to the epidemic within prisons. Ministries of Health in El Salvador and Nicaragua have important partnerships with civil society organizations, creating a constant loop of feedback for the Ministry of Health to report stigma and discrimination at clinics run by the government. Inclusively, part of the work that we are doing at NASTAD is at the request of these civil society organizations and is to create dashboards with data from the Ministries of Health surveillance systems, also providing information about HIV and where people can get tested and treated. In El Salvador, we also provide training for community and healthcare workers on how to provide comprehensive services for folks within the LGBTQI+ communities. All countries in the region are supporting testing and treatment sites focused on being safe spaces for these communities. Being able to share these accomplishments with the countries we work with in Central America has been a privilege for me this World AIDS Day, but it's important to note that much work still needs to be done, especially to combat stigma, discrimination, and isolation if we want to end the epidemic.